Hello people, in this video let us look at the essentials of practical pathology for MBBS students, right? So in this video, in this book, what and all is there, let's look at. Okay, focus here guys. Hematology, you know that you will have to check for RBC count, etc. WBC count. Anemia, basically anemic picture you should know, people. And they're talking about bone marrow examination. So parasites also, that's mostly like a microbiology thing, but anyways, they have given that here. Surgical pathology, what is this? Cell injury, necrosis, inflammation, how it will be, glomerular inflammation. But why, that won't be, what am I talking about? Sorry, granulomatous inflammation, okay. Neoplasia. So neoplasia is very, very important in pathology because these are the people who grade it, right? How will you stage it, grade it, etc. So neoplasia, very, very important for you. So these are the contents, guys. Diseases of breast, thyroid, bone, lymph node, brain, diseases of brain, etc. So you have two things in pathology. You have the gross and the microscopy, okay, in the practical. So you have to focus on both. So let's look at peripheral blood smear, very important. This is like for every patient, they almost do this. So peripheral blood smear examination. So you can know all those anisocytosis and all that, right? Otherwise, anemic picture and all you'll come to know even from the machine. Why would you ask for a pathologist to look at the blood under a peripheral smear? Why would you do that? Because you'll get a manual count of certain things also, platelet count, etc., right? And you can observe the morphology. Manually you can observe the morphology of these cells. Guys, focus. I think I like this book because it has a lot of images and you can carry it to your lab also, looks like. Compare it with the other books available and be aware of any mistakes that are there in these books. Always better to have one solid book without mistakes. It should be reliable. So like we told you always, there is a gross specimen and a microscopic image. So this is osteosarcoma showing the lower end of femur, bulky expanded tumors sparing the epiphyseal cartilage, which is here, right? So this is affecting what? The diaphysis, is it? It's like one side of it. So they're telling about, okay, it's the metaphysis. Okay, metaphysis, this is the diaphysis. So epiphysis, metaphysis, diaphysis. So they're talking about the osteosarcoma, right? So this diagram you will draw in the record and then the exam. This is how it looks under the microscope, looks like, right? So osteosarcoma showing tumor cells. So here they are showing areas of calcification in the arrow. Where is the arrow? Arrow, please. In the original they didn't show any arrow. Okay. So they are showing giant cell also. What I see is they have marked A here. A they have written about. Where have they written about B? Is it in the next page? No, it's not in the next page. Okay. So looks like B is the hand drawn. What do you say, people? Am I missing the B's explanation somewhere? Okay. So some things, let's look at this table. Different colors of urine. Colorless is dilute urine. Red color means hematuria, or they ate some beetroot, I'm thinking, right? Myoglobinuria, hemoglobinuria. See, hemoglobinuria, hematuria, what is the difference? Hematuria is having RBCs. Hemoglobinuria has the hemoglobin, that means ruptured RBCs, right? Myoglobinuria, porphyria. See, there is something called as cola colored. Cola colored is again hemoglobinuria, right? Because there is rupture of RBC. So the hemoglobin will make it cola colored. Okay. So what are these again? Urinary casts. I think this book is kind of interesting and useful for you. Thyroid. What are they doing here? FNAC in a palpable mass, in a thyroid swelling. Have you seen FNAC, people? Go see it in your pathology lab. So what do you see here? Serum electrophoresis. This tells me about what? What is this telling you about this? Look at this skull, how it has punched out lesions, right? So come on, see what the disease is. Look at this, they have given the exercise here. He has bone pain, 65-year-old male. And they're showing you that he has anemia, that means his bone has some issue, right? Probably it's not manufacturing enough of WBCs also. And look at the question, what is the diagnosis? What is the diagnostic criteria? What are Bence-Jones proteins? That means once you know Bence-Jones proteins, you know the disease is multiple myeloma, don't you? The question itself is giving away the answer. Let's look at the answer anyways. Multiple myeloma, you guessed it right, good. Now there is also one more chapter here called as instruments, okay, that's nice. Look at this, all the vacutainers, you should know the colors of the vacutainers, why they are used, what they contain, that they have, why they have what they have. This is your Sahli's, right? Am I right? Sahli's hemoglobinometer, right? What is this? Spectrophotometer. Is it spectrophotometer? You have a WBC. Sorry, this is what is this? Is a colorimeter. Okay. This is a WBC pipette. All this they'll keep for your spotters, people. So you should know all this, which I like. I like it that there are a lot of images here. So it gives a lot of confidence. In the last minute, we can read the spotters, instruments, and go there, right? This one is like very difficult to know everything. Multi-sticks. This is for the urine, no? You can find out the pH, protein, glucose, ketose, bilirubin, blood, urobilinogen. Wow. Leukocytes, everything you can. Go and check out in your pathology lab. Okay. And reference values of all the pathology values, how much hemoglobin should be there, etc. One thing you note here, at birth the hemoglobin is quite high. Till 19.6 they have given. At birth, hemoglobin. But normal adult, 12 to 17. Do you know your hemoglobin value? Minus 13. So I'm very happy. Just check yours, okay? So this is practical pathology for undergraduates. Book looks good. Make your decision. Bye-bye.